Good morning, everyone. I am Dr. Bianconi. I am a dentist, and I have specialized in the field of dental implantology. An implant is an artificial root that replaces the natural root present inside the bone, on top of which the crown is created for completion. Implants cannot always be placed. There are plenty of situations in which placing an implant becomes really difficult, primarily due to a lack of bone tissue. If we do not have sufficient bone thickness, we need to perform what is known as a bone graft. Bone grafts that initially were only obtained by tissues taken by the patient themselves have now been replaced by a new type of graft that does not need to be taken from the patients. Bone grafts are lengthy procedures, as it takes months for the grafted bone to be incorporated into the natural bone matrix. A new surgical technique called overgraft has been developed. Overgraft enables us to perform the implant placement and bone grafting in the same surgical session. This allows us to solve a case in just 5 months instead of over a year. Of course, we're talking about cases in which the implant cannot be immediately placed after the natural tooth extraction in the posterior regions. There are plenty of advantages, which include reducing healing time, reducing patient discomfort, and also achieving a better biological response that is even better than the one that would have taken place waiting 7 more months. By better biological response, we mean a perfect integration between the grafted bone and the implant surface. The most complex cases, those that could not be solved in an optimal way with traditional approaches, are the most suitable to be treated with the overgraft technique. Yes, the overgraft technique received various awards. It was awarded first prize by the New York University in the category Dental Implantology Innovations in 2019. It has been published on various international journals and is a registered trademark in the US, Israel, Switzerland, the EU, Russia, China, and Japan. We treated more than 500 cases in the last 10 years.